everyone. Just waiting for Brynn. I see her. There we go. Brynn, it says you're unable to join. Let's try again. There we go.
Hey.
Hi. Good. Okay. Perfect. Okay. Let's just give people a little bit more time. We look much different than we did Saturday morning.
We clean up nicely.
We do.
Us Weekly magazines where they're like celebrities. They're just like us, and they're out and about with like their coffee and
I know. No.
hair old.
I think we should have done it the way we looked Saturday morning.
Maybe that's a new trend we could start. I would totally be.
I think everyone should just show up to these in pajamas, no makeup, unshowered.
I mean, talk about like being your most authentic self, right?
Exactly.
Yeah.
Okay, so let's get started. Can everybody hear and see us okay? Everyone just kind of give a thumbs up. They can hear and see us. Anyone? Can you hear us? Yes. Okay, we got a thumbs up. Okay, awesome. So thank you everyone for joining us tonight. I'm really excited about this one. I'm going to let Brynn introduce herself because she'll do a much better job than I will. But I just wanted to kind of just thank everyone for joining, and I'm going to get into specifically why we selected this to do. But kind of, I would say over the last couple months, I've gotten a ton of questions about narcissistic personality disorder, narcissism in relationships, defining it, identifying it, coping with it. And one of the things that keeps coming up routinely is this idea of addiction of any type within a relationship with someone who has narcissistic personality disorder. So Brynn is an expert in addiction, and so I wanted to bring her on and talk to you guys about how narcissistic personality disorder and addiction can look the same, can feel the same, but are inherently different in terms of their treatment and their course of progress and prognosis, and also how they're similar. So I'm going to hand it over to you. I'm going to have you introduce yourself, and then we'll kind of get the ball rolling.
Okay, great. Well, thank you so much for having me. I'm really excited to be here. And this is something, working with clients that have a history of substance use disorder or that have been impacted by substance use disorder is something that I'm incredibly passionate about. I've been working in the field of substance abuse for over, 10, 15 years at this point. So I'm a local therapist down on the main line. I'm a licensed marriage and family therapist. Main line in Pennsylvania. I know there's probably viewers from all over. In Wayne, Pennsylvania. I'm a licensed marriage and family therapist, and I also what's called a certified advanced alcohol and drug counselor, which is a master's level certification in the state of Pennsylvania. This topic is important to me because there's a lot of times when I'm working with individuals that are in recovery or have a history of substance abuse, and I hear a lot of friends and family members say things like, it's all about you, you're so manipulative. They like to throw around the word narcissist as well, which I think is just a lack of education about what that actually means. And so there are things that happen in active addiction, and there's also behaviors that you'll see in recovery as well that can mimic a sort of selfishness that I think can be misinterpreted as narcissism that is neither selfish nor narcissistic. Mm-hmm. So I think it's really important to understand the full gamut of it, what it looks like, how it impacts relationships. And then you and I have talked about how then do we support people in communicating with their loved ones that either have narcissistic personality disorder or a substance use disorder.
Mm-hmm. Or both.
Or both, right.
Or both. So I don't specialize in addiction, and it's a very specialized treatment protocol, and it's correct me if I'm wrong, but you need a specific certification. Is that right?
So it's not required in the state of Pennsylvania. However, there's a lot of individuals in the field of recovery that will say, oh, my mom was an alcoholic. I know how to work with alcoholics.
Right.
I've done the 12 steps. I know how to work with someone who has addiction.
Yeah.
And while for any therapist, any psychologist, any clinical social worker, our experiences can certainly help inform who we are and help inform our questions, it should not be the avenue which we define ourselves as being experts.
Yes.
In addition to all the supervision for my license as a marriage and family therapist, I also needed additional supervision to have the advanced certification. I need additional CEUs. So it is something that I think is really important, that you know exactly what you're talking about.
Yeah, and that's why I wanted to ask that, because I find that, you know, even if I have a patient, let's say, that has severe depression and they are kind of drinking a lot or, you know, doing drugs and it's affecting their life, I refer them out. And I'll kind of co-treat with a specialist, because it's in my opinion, it's a whole different ballgame. They overlap and we kind of help each other, but it really is a specialized kind of concentration, and you really have to know what you're doing.
Right.
So, okay. So one of the things,
real quick, I just saw a question pop up that said, will this address gambling addiction as well? So my specialty focus is within chemical substance abuse, so drugs and alcohol. Gambling addiction is currently the only what's called process addiction that is recognized by the DSM-5. So there are certain similarities, but I'm only going to speak from the viewpoint of drug and alcohol, of chemical abuse.
So what I want to do first is just kind of go through the difference between narcissistic personality disorder and narcissism, because as you said, people tend to kind of throw around these terms a lot. And I think that a lot of times, and I say this all the time, someone's just an asshole in the relationship, right? They cheat, or they, you know, steal money, or they're just not nice to you. That doesn't mean they're a narcissist. It doesn't even mean they have narcissistic features. It just means that it didn't work. They're an ass, whatever, it happens. And maybe they're just difficult to get along with for a million other reasons. But that doesn't mean that they're a narcissist. And it definitely doesn't mean they have narcissistic personality disorder. So every single one of us has narcissistic traits. Some of us have more narcissistic traits than others. Some of us, our narcissistic traits come out in certain domains more so than others. So if we're with our kids, they may not come out as much, but let's say we are presenting at a conference, maybe it will come out a little bit more. And who knows, just because that's our specialty, that's our field, so that's where we feel, you know, as an expert. So it varies, and the important thing to understand is that narcissistic traits and narcissistic features are fluid. They fluctuate based on the situation. If they don't fluctuate, if they are fixed and they don't fit to the situation as needed, that's when you're looking at less awareness, less insight, more likely to, if you think of a personality disorder on a continuum, right? So let's say down here we have more of a dependency feature, down here we have narcissism. The more narcissistic traits you have that are fixed, that don't fluctuate with the situation, meaning you're like this in every single situation, in every single relationship, unless you're manipulating it. But generally speaking, you're a narcissist in all situations. That means you're down here. It's not changing. That is more of a narcissistic personality disorder. In the middle, it's going to fluctuate based on situation. If you're all the way down here, this is more of a dependent personality style. This is unhealthy as well. So our dependency and our narcissism fluctuate throughout. Narcissistic personality disorder, dependency, fit together very well, but is also one of the most toxic relationship styles and the most difficult ones to break. And Brynn will get into this, but oftentimes somebody who, let's say, has more narcissistic traits for whatever reason, or has an addiction problem, or both, tends to gravitate towards people on the dependency end of things, because people that have that dependency feature, that put their needs second, that are always kind of looking out for others at the expense of their own needs, tend to be also enablers. And you know, obviously, yeah.
To active addiction.
Yeah. And so, and Brynn will talk about this, because you know, when you're, I'm sure you see this all the time, the dynamic of enablers and addiction, and she'll talk about kind of where the narcissistic piece fits into that. So I'm gonna kind of hand it over to you to talk about the differences, and we had touched on this on Saturday, kind of the hallmark differences between the two, and we'll start with that.
I think one of the most important features that we really need to look at is the component of empathy and also the component of shame. I think those are also, when we talk about the continuum, right? I think that they're also on a continuum as well. And when we are looking at someone who is in active addiction or who is even in recovery, they feel bad about what they are doing. It doesn't feel good for them to manipulate other people. It doesn't feel good for them to get one over. It may, in the moment, on the way to accomplish the goal of using drugs, right? And then they use the drugs, they have that euphoric high, they have that chemical rush, and then that's it, right? Then they feel terrible. They don't want to be in that position. They don't want to be living that lifestyle. They wish they could just be at home with their families. They wish they could rebuild relationships and reconnect with other people. So
regret and remorse and feeling badly about the manipulation, being aware they're responsible for the consequences of their actions.
Exactly. And having that experience of what I would say is both guilt and shame. So it's important to recognize that there's differences in the two. So guilt is when you feel bad for something that you did, right? So when your child draws marker on your wall, not that this ever happens in our homes.
No, not day one of quarantine lockdown. No.
Not with a Sharpie.
No.
But when that has happened, they feel bad, right? Oh, I'm going to get in trouble. I did something wrong. Okay. When you experience shame, that's when you feel at your core, you are wrong, that something is wrong with you. And a lot of individuals, I mean, I really have to say there's probably, I can't think of anyone off the top of my head who has a history of substance use disorder that does not feel shameful, that they don't feel, what is wrong with me? Why do I continue this behavior? And the addiction is actually a function of supporting that. So you may have someone that you could say has hit their rock bottom, and that looks different for everybody, right? And there's a phrase in recovery that says, well, when did you hit your rock bottom? And it's like, well, when I stopped shoveling, you know? But what we're looking at is someone who says, this was terrible. Someone on the outside with no history of addiction would say, oh, well, then did they get their act together? Did they get sober? Did they get into treatment? And you go, no, they kept using as a way to support that shame. See what a terrible person you are? You can't even stop using, even when this happened, even when this terrible thing, this rock bottom occurred in your life. And so that inner dialogue is really strong and really present. And then we see that in recovery, right? So that really comes out when people are in treatment, trying to get clean and sober. They are then saying, God, I can't believe I did these things. I feel so terrible. If they're following a traditional 12-step program that really supports people owning their mistakes and making amends to other people, and that becomes a really difficult process. And so, again, just to summarize that piece, it's really looking at empathy, it's really looking at shame, it's looking at guilt, and it's also looking at, have these behaviors, have these traits been expressed before the addiction took off, right? So as kids, as teenagers, did they demonstrate empathy? Did they demonstrate guilt? Did they demonstrate remorse? Or maybe not. And then maybe there's something else happening there.
So I'll take it from the personality disorder end of things. Somebody with narcissistic personality disorder will not have shame, guilt, remorse, empathy, sympathy. They lack that. They'll fake it, but they don't have that at their core. Like Brynn was saying, at the core, you feel like you did something wrong. Someone with a narcissistic personality disorder, they either don't think they're wrong, or they know they did something wrong, but they don't really care. They don't really care what the consequences are because it benefited them, so be it. It doesn't matter. There is no empathy unless they fake it. There is, in fact, they did a study. I forget. I'll find it. I can post a link if I can somehow find it. But they had tried to teach empathy to people with antisocial personality disorder and narcissistic personality disorder, and it appeared to work, but really what happened was they just learned how to use the empathy strategies to manipulate others. So there really is this disconnect. And like Brynn was saying, prior to an addiction or an addiction diagnosis, or prior to them starting the path of that addiction, somebody with narcissistic personality disorder never would have had that shame, guilt, remorse, empathy prior to the addiction. They would have lacked it then. So it's a really good kind of key indicator to ask family, things like that. Were they like this before the addiction, or, you know, or were they different before the addiction? So that's a really kind of telltale sign, because either you have it or you don't. Addiction may kind of mask it for a little bit because you're engaging in, you know, risky behaviors or unsafe behaviors or behaviors that are, you know, bad and have consequences. But with narcissistic personality disorder, that empathy never was there, is not there, and never will be there, even after the addiction is in recovery. So that's very important to keep in mind. The other thing too is that for people with narcissistic personality disorder who do have an addiction, chances are they're not coming into Brynn for treatment because they don't think anything is wrong. For the same reason that I don't get anyone in my office really with narcissistic personality disorder unless the spouse who I'm seeing brings them in for a session. They end up hating me within 5 minutes because they know I know their deal and they don't come back. So I'm going to assume it's, and correct me if I'm wrong, that it's the same for you, that people with narcissistic personality disorder who simultaneously have an addiction only seek treatment if it ends up being court mandated, if it's, you know, some sort of DUI or a custody thing, or they get arrested and somehow it's mandated counseling or mandated treatment. Other than that, you're not going to see them, and chances are the recovery of addiction is going to be a lot less likely than somebody who does not have a personality disorder, who has more of a depression or anxiety or something like that.
Right. Yeah, absolutely. So I would only see individuals with both diagnoses if it's court mandated in some way,
Right.
or in couples. So I do work with a lot of couples where addiction is present, and they will come in as a way to manipulate the relationship to, you know, appear as if they're caring, but same thing. They don't stay, they don't, you know, hang out for very long. They're not very interested in therapy. And it's really just, if you as the therapist are not supporting their narrative,
Yeah, they're out.
Right,
They're
exactly.
out. Yeah.
Right.
And they'll hate you. You're the worst therapist ever. Right.
Yeah.
So I want to go through some of the questions that we got. And for people, feel free to ask questions in here. I'm going to write them down and just go in order of the ones that we had gotten ahead of time, and then get through these if we can. So one of the questions that I got, and I'll answer this very quickly, this doesn't really have much to do with addiction, more so for narcissistic personality disorder. Is there treatment for this? Sure. But they don't come in for treatment. They will never, ever, ever, ever change. If you are in a relationship with someone who has narcissistic personality disorder and you're trying to get them back to who they were when they first met you, that was not them. That doesn't exist. It's a false image that they suck you in to try to kind of get you back. So as far as narcissistic personality disorder and treatment go, this is who they are. They will not change. I never say that about any other diagnosis except this one. They can manipulate that they change. They can appear to change if it benefits them, but at the core, they're exactly the same.
Well, too, when you were talking earlier about the continuum and how, you know, when you're on that end of meeting the diagnostic criteria for the personality disorder, it's because the traits don't go away, right?
Correct.
Every area. Yeah. And so it could be that they are manipulating the couples therapist.
Right.
But then again, if you have a therapist that is engaging in, you know, multi-directed partiality and really connecting to all sides of the room and really raising everyone's voice, they're not going back to that therapist.
No, they're not. And you know, aside from that, you know, as far as manipulating the therapist, and I say this in the nicest way possible, you should not be treating somebody with narcissistic personality disorder if you are not able to detect it from like a million miles away. You know as well as I do, when you get a phone call, you can tell within the first 30 seconds if this is somebody who has a personality disorder. There is an immediate disconnect. You get that feeling, you get that vibe. When you're working with people with narcissistic personality disorder, it can be extremely dangerous if the therapist is not well versed in the nuances of narcissism, because they will get sucked in, roped in. I've seen this happen. And if it's couples therapy, the spouse of the person with narcissism ends up feeling so helpless, so lost, worse than when they came in, because now this spouse has manipulated the therapist even more. So that is more about narcissism. I have a lot of stuff on narcissism on my page, on my highlights. There's 3 sections on it, so feel free to reference that. So somebody asked, is there any other disorder clusters that mimic addiction and narcissistic personality disorder?
Ooh.
I thought of one, but
yeah, here's the deal. There's certainly a lot of co-occurring disorders when it comes to substance use disorder.
Can you talk a little bit about the common co-occurring disorders?
Yeah, and so it's actually like a range of that, right? So a lot of times, substance use disorder, is it a disease of the brain? Absolutely. Is it also, in my opinion, an expression? I say to people, and I hope it's okay if I curse here, but I say there's like a bunch of
I said asshole in the first 5 minutes.
Oh, there we go. Right. I'm like, there's a bunch of shit that happens in your life. And then a lot of times you end up expressing it like in this way. Right. So, and it's triggering the genetic disposition that may be at play. Okay. So things that I see that are co-occurring that happen simultaneously with addiction, like ADD, ADHD. Right. So how does that play out?
That's a great one.
You know, they're not being picked up on in school as ADD, ADHD, mostly boys. It's just, oh, they're wild. Mm-hmm. That's how boys are. Mm-hmm. They can't sit still, right? I had a client one time who literally did not know how to read. 23 years old, couldn't read. Asked me to read information to him. And I said to him, how the hell did you get through school? And he said, I was a behavior problem. So they just kept passing me on to the next one. So then now we have this kid who's 23 years old who can't apply for a job because he doesn't literally know how to read. He gets put in all behavior support classes because he can't read. And then what ends up happening? Who does he fall in contact with? His family's not supportive. They don't understand what's happening for him. And so drugs and alcohol become a way of coping with that, right? So that's one example of ADD.
And also the impulsivity with ADHD, their judgment making, their, you know, your frontal lobes are not functioning the way other people's are. And so you're more prone to make quick, irrational, impulsive decisions. So you may be the one that tries the drug first, whereas somebody else may worry about it. Am I going to die? Is something going to happen? Am I going to get caught? Someone with ADHD doesn't necessarily think like that. And that can kind of open the door to addiction as well.
Right. Other ones that come off the top of my head, certainly, you know, some presence of trauma, you know, whether it meets the full criteria for PTSD or not, generally, again, like 90% of individuals that have a history of substance use disorder, like trauma is also a history.
Can you talk a little bit about why alcoholism and drug addiction is so common from an avoidance standpoint, behavioral standpoint with trauma?
Oh, absolutely. So when someone has traumatic experiences or a history of complex trauma, you know, where it's happened multiple times in their life, a couple of things can happen. One, either the drugs or alcohol can really help them like zone out, right? And not be a part of life, and also limit their experiences with flashbacks. So if we black out to go to sleep, then we know we're going to sleep. It's not the healthy sleep that our body needs, but we know that we're going to go to sleep, right? And then we also know that we're not going to be waking up in the middle of the night with flashbacks, right? We know that we're not going to be waking up with panic attacks, or we're not going to be waking up dripping sweat because we're having traumatic reoccurrences.
Right.
What can happen is that it can give us a false sense of confidence, right? So when we have traumatic experiences in our life or complex trauma, and we have those trauma responses where we're not trusting ourselves, where we don't know how to trust other people around us. Not only do drugs and alcohol help us kind of numb out from the world, but they also help us feel a little bit better about ourselves,
right.
and a false sense of reality and a false sense of confidence.
Right.
Sometimes people have that traumatic, they're numb all the time. And so by using drugs or alcohol, they will actually feel alive. And for those individuals, you see more of like a cocaine use,
right.
More of drug use, things like that.
Right. Yeah. And also what ends up happening too with addiction and trauma. So the more you use it, obviously the more you need, your tolerance is higher. But also what happens, like Brynn was saying, your belief in your ability to cope with this without substances goes down significantly. So you never you kind of deprive yourself the opportunity to see that you can handle this with emotional coping skills and regulation skills rather than substance. The other thing that happens is something called, we won't get too much into this, but the anxiety rebound effect, which is when you're using things that are depressants. And when I say depressant, I don't mean it makes you depressed. I mean, it kind of depresses all your functioning, your breathing, your heart rate, things like that. The more of that you use, your anxiety, even though temporarily it's helping reduce it, when you wake up the next morning, that anxiety is going to rebound. This happens a lot when people take Xanax, Ativan every single day. If you're taking those types of things more than twice a week, once a week, you're actually making your anxiety chemically worse because you get rebound anxiety. And depression, alcohol works on those same receptors. So what ends up happening is you drink to avoid this discomfort, this anxiety, this depression. You wake up the next morning and the alcohol's out of your system, the drugs are out of your system, your anxiety goes sky high, not because you're worse, but because the chemical interactions that just occurred in your body is causing, everything that's responsible for anxiety to go up. So you want to keep that in mind, that especially with a trauma event, that's kind of why I wanted you to discuss that even though it feels like you're temporarily making yourself feel better, there's a lot of consequences of doing that, not just behavioral or cognitive and emotional, but also like biological that's happening and neurological.
Absolutely.
The only other diagnosis I was thinking of that can kind of coincide with addiction as far as personality disorders go is borderline personality disorder. And borderline personality disorder and narcissism can look very similar, but the way that they differ is that borderline personality disorder, as difficult as it may be to treat, it is 100% treatable. Patients can absolutely 100% get better. They may always have a rocky time with certain things and handling their mood and constantly having to be mindful of that, but there is very effective treatment for it. And you see a lot of that, with a lot of trauma history and addiction history. So that's really the only other one that I could think of that looks like narcissism. But the main difference, even though they look alike, is that it's completely treatable. They want to connect. They want to feel better. They just have a lot of difficulty doing that for numerous reasons. So that was the only other one I could think of.
Yeah, I was going to say borderline too, but I was going to say borderline also because there's such a strong dependency there that someone with borderline personality disorder has on other people.
Yeah.
So a lot of times, if we want to categorize as like the ADD addict is the leader, the borderline personality disorder addict is the follower.
Yes.
Right.
That's a great way to explain it. Yeah, I like that. So the other one that I got was, are people with narcissistic personality disorder more at risk for developing an addiction than somebody who has depression?
Ooh, more?
I actually think less. I think depression's higher.
I was definitely saying in comparison, I mean, are they at risk? Yes, of course.
Yeah.
More depression, I would say no.
Right, I agree. Yeah.
Other ways for them to express and manage and manipulate. Yes. And I think depression is a very
like this
chemically rooted disorder, and so is substance use disorder. Not exactly in the same vein as personality disorder.
Yeah. I think with depression, you are more cognitive in the midst of a major depressive episode. You are cognitively very limited, right?
Like,
Your brain is not working at capacity. You are very fatigued. You have no motivation. You have no cognitive energy to do any sort of figuring anything out. So substance abuse is easy. It's accessible. It helps you avoid. So, you know, I feel that that's kind of why that would occur. And it's, as you said, more deep rooted. Narcissistic personality disorder, they're not lethargic and unmotivated and sad and can't get out of bed and don't want to be around people and feel bad about themselves. If anything, it's quite the opposite. So they really have no, in their minds, they have nothing wrong with them. So there's really not a reason to avoid any pain or discomfort. What you do find sometimes is there's sex addiction a lot of times with narcissistic personality disorder because they feel entitled to have multiple partners. So you see that a little more, maybe more of like cocaine addiction, things that kind of
their sense of who they are.
Yeah, thank you. Yes, inflate the sense.
Right.
Whereas alcoholism kind of keeps people numb and muted almost, so they don't have to feel.
Right.
You know, I guess some people when they go to cocktail parties, they have a drink or two to relax themselves, but you do too much of that.
And I think that is an important distinction too, because I think generally people associate alcohol with being more of a, what would you call like an upper, right? More of a life of a party.
Yeah.
Not like chemically, it depresses your central nervous system.
Exactly.
So progressive use over time absolutely will result in that anxiety rebound we talked about. Progressive use of alcoholism over time will absolutely could result in very severe depression.
Yeah. Right.
Narcissism will usually not swim in those waters.
Correct. Right. Exactly. So if they again, there is addiction in both of them, but it looks different, and it has a different function to it. One is to enhance their sense of self and their self-image, and the other is to run from it. So they're very different in that respect. And the other question I got, and this is kind of a loaded question, so feel free to answer this however you like.
Okay, I'm ready.
The question was just very vague. How do you handle working with someone who has narcissistic personality disorder and addiction simultaneously in marriage therapy?
So again, like we talked about, they're not going to stay. Generally, if they do agree, so I'm at an outpatient level of care. So if they're at a place where they need an inpatient level of care, they'll go, they won't stay, they'll leave early. They'll say, you know, that place
they'll check themselves out, you mean?
They check themselves out. There were, incompetent therapists that were there. The doctor never saw me. I mean, you could literally send them to whatever in your mind is the world's number one treatment center. And everyone there is an idiot, and no one knows out. And then what ends up happening, the spouse usually has more of a dependent personality, is like, okay, well, we'll try another one. We'll try another. Let's do. We'll at home, you know. Spouses in general, it's incredibly complex to be in a relationship with someone who has a history of substance use disorder, like incredibly complex, because when the addiction is active, the non-addicted or the non-consuming spouse is trying to control the addiction, right? Well, I've heard things like, if I promised my spouse sex tonight if we left the party early, as a way to control the addiction, right?
Yes.
Kept having kids. I kept getting pregnant because when I was pregnant, wouldn't drink, right? Or when we had a newborn, they wouldn't drink. So I would, attempt to control the addiction in that way. Or I would take the keys, or I, assumed responsibility for all of the finances. So this is just spouses, when addiction is present within a marriage without personality disorder.
And if you think about it, that's without a personality disorder, right? And there is no way, I think, that somebody who doesn't, who's not, if this continuum, dependencies down here, there's no way that all of that effort and energy that the spouse puts in would occur if that spouse is more on this side.
Right.
That it wouldn't happen. It wouldn't, the neuroses wouldn't fit. There would be a hell of a lot more arguing. They probably would break up sooner. It could get more volatile. So there's a lot of things that could happen. But generally speaking, when they're trying to cater to the addiction, they're constantly putting their needs second. They're constantly it's always about the other person, which is why it tends to look like narcissism, when really it's the person on this end of things that's kind of making that pattern so, in a way.
Yeah, it's really, you know, I often, when I'm working with couples and we're talking about the presence of addiction, a lot of times I like to use the analogy of a mistress that you can't see, right?
Yeah.
Being, it really is this third person that comes into the relationship and everyone's trying to maneuver around it, but we can't actually see it.
How does that go over?
Well, I mean,
I like that a lot, actually.
It's helpful. I'm a very visual learner myself. So when I clients understand things in a way that they can actually picture, it seems to be helpful to them. I don't use that with clients where a mistress has actually been present in the relationship, because that's certainly, you know, a whole nother level of trust. That's, you know, that's, but yeah. So all of that is present when, narcissism isn't even present in the relationship, like all those times. And then what we see in recovery, so when the using spouse does get a treatment, it's really a complex challenge for both couples to say, okay, what am I responsible for? What am I not responsible for? How do I maintain those boundaries and still have a marriage, still have a relationship where we are connected and when we are investing our time and our energy and our love into that?
Do you find that once a person is in recovery and has stayed in recovery, the dynamics of the relationship kind of fall apart because in a way it's not what the person with the dependency enabling features signed up for, in a sense, that was their sense of purpose, that was their identity, was taking care of this person's addiction. Now that addiction is no more, and that person can be more independent and the mistress is gone, now this spouse doesn't really know what their role is anymore in this relationship. Do you see that happen? Because with narcissism, it's not going to change. That role is always going to be there because the narcissist is going to change. But in addiction, that role is going to change.
The way that I see it, I would state it a little bit differently. But yes, but this is how I would state it, and this is how I see it, is that when a person has established recovery, they've established long-term recovery, one is sometimes those behaviors do manifest in other ways. So that need to control is still there, right? So whether it's they then dive into work, or they dive into gambling, or they dive into the gym. So we have to keep that sometimes that need for excess sometimes will show up in other areas. When that need for excess has really been treated and it's not showing up in other areas, I don't conceptualize it so much that the spouse has lost their role, but that the spouse really struggles to do their own work. That's so much easier to say, look at this glaring problem over here. This person who's been stealing money, who's been using drugs, who's been drinking, who's, you know, put our children at risk, whatever the case may be. And then it's like, okay, well, that person's fine. So I guess I'll just
focus on me.
And I don't know what to do with myself. Right. And so there can be a lot of conversation about individual therapy for the spouse doing their own work, the spouse joining support groups, and there's a lot of resistance that can come up with that.
And I would imagine that that's a component of codependency, is that they were just as dependent on this person's addiction to kind of hide and avoid their own stuff. And now that addiction is no longer there, they're forced to face their own stuff now. And that could be even more difficult for them.
And even just the shame that they experience about they went to cover up the addiction. Told to, you know, kind of try to protect their spouse, you know, like in a loving way.
For sure. So what do you do how do you handle then it looking like narcissism when there's relapse, let's say, and they have to kind of again focus so much on this person's recovery, and that it is all about them, it's not even about the kids, it's just constantly about their addiction? How do you explain that to a spouse who really thinks that their significant other is so self-centered and so selfish?
So we really do a lot of psychoeducation about the disease of addiction, and about that, you know, I do not there's a phrase like relapse is a part of recovery. I don't think relapse has to be a part of recovery. I think you can learn a lot from it. So we do talk about like relapse prevention planning and what that looks like and what would be some warning signs, and also really supporting communication within the relationship, where if the non-addicted spouse is like, oh, my addicted spouse is working a lot more and that's a danger sign for them, or my addicted spouse has kind of stopped going to meetings and that's like a danger sign for them, that they've established this mode of transparent and direct communication where they can say, hey, listen, I don't know how you feel. Maybe it's just been a rough week, but this is what I'm seeing. And it's not accusatory, and it's not challenging them, and it's not saying, you've really been an asshole lately, and, you know, I think you're using. You know, like you can't come at someone like that, because that's just going to throw up all the defenses that are there. So we do a lot of that work. So should relapse occur, you know, and I'm very clear with clients and what to expect. Like, it's not going to feel good for anybody. Right.
Yeah.
But about it. How do we support one another? How do you guys support one another as a couple? And then who do you each individually feel safe with in terms of letting people know what's happening for you? You know, you're not going to take a billboard out of 5, but you're also not going to keep it to yourself, because that's not healthy either.
And how about towards the kids and kind of getting in their minds that it's not selfish as far as narcissism goes, but more so just kind of being blinded by this disease?
So when we have this genetic predisposition within family, when we have one parent or two parents that have a history of addiction, or even grandparents, it's incredibly important for that to be transparent within your family.
Yeah.
Right. So SAMHSA, the Substance Abuse and Mental Health Authority governing body in the U.S., when they are tracking every year their statistics for mental health and for substance abuse, they track the age of dependency, right? That the age that they start tracking that at is 12.
Wow.
Dependent. So we're looking at first use 9, 10.
Dependency at 12.
Dependency at 12.
So
yes.
what time is, so when do they start using?
Right. 9, 10, 11. Right.
Okay. Wow. Okay.
Right. So it's really important, you know, whether parents want to come directly out and say, hey, this is a part of our family history.
Yeah.
You've been open about this. Or we're just talking about in first grade, making good choices, being proud of ourselves, being able to talk about hard things, really modeling all of that behavior. Yeah. 2 other resources that I think are incredibly helpful. So one is a local resource in Pennsylvania. It's called the Mariposa Foundation. So I don't know if you're familiar with that.
No, what is it called?
Mariposa, Mariposa. Camp Mariposa. That's what it's called, Camp Mariposa. Okay. So I'm going to screw this up. There was a pitcher for the Philadelphia Phillies who, after he retired, joined with Dr. Claudia Black and her work. And she's like the guru of family addiction. And they developed these camps. And Camp Mariposa is for children ages 9 to 12 years old who have a parent that's either in active addiction or in recovery. It's free. It's 6 weekends out of the year, and it's held right on the Penn Foundation campus in Boxer Berks County around here. So they do a lot of work in empowering kids. They hit that 9 to 12-year-old age range, right? They do a lot of work of just talking about addiction, what it looks like, how it presents. The other resource, and it's a shame I don't know who thought of this, is called the 7 C's, like the letter C.
Right, you had talked about that, yeah.
Yeah. First, it started out as the first 3 C's of addiction, which we tell kids, it's I didn't cause it, I can't control it, and I can't cure it, right? So that really alleviates a lot of responsibility for them, or any family member for that matter. What was happening though is like, okay, that doesn't tell us what we can do though. Like, that's great that I didn't cause it and I can't control it, and
but now what?
I do, right? So they came up with the other 4, and the other 4 are, but I can take care of myself by making healthy choices, communicating my feelings, and celebrating myself. So that, again, is really geared towards children, but I think you can absolutely apply it to anyone who is in a relationship or has been impacted by a family member that has a history of substance use disorder.
Sure. So talking about genetic predispositions, alcoholism, addiction definitely does and can. Somebody asked, Jojo, I think that was you, can narcissistic personality disorder be genetic? So there is some research that says that there can be a genetic component to it. However, majority of the time, it is a learned pattern of behavior, a very maladaptive one, a very pervasive one that over time, growing up in a certain type of environment, that the child develops as almost like a survival mechanism. So at the time, that pattern of relating to others, usually parents or primary caregivers, it worked for them. Let's say, for whatever reason, they were told very early on that nothing they ever did was good enough, or that quite the opposite, that they are the golden child, they can do no wrong, and therefore consequences and rules and laws just don't apply to them because mom and dad get you out of literally everything. You get arrested, they bail you out. Everything was without consequence, so you never learned, and you didn't have to learn. Or it's usually it's an extreme of some sort. So the pattern that children develop is really kind of a survival tool to be able to get through that. The reason why something becomes I'm generalizing this, please understand, it is not this simplistic. The reason why something becomes a personality disorder is when that pattern of relating to the world does not shift as the person is in different situations, as they get older, as different events happen to them, and they end up responding to their spouse the same exact way they responded, let's say, to their mother or their father or their sibling when they were 10, because that pattern of relating to the world never shifted, it never changed, it just got stuck and it stayed, and that's the only way they can relate to the world, and it's extremely maladaptive and it doesn't work and it causes significant problems. Narcissistic personality disorder is a little bit more unique in that it causes significant interpersonal problems. It causes financial problems. It causes every problem that all the other ones would, except that the person doesn't view it as problematic because it's not their problem. It's not their fault. If they lost their job, it's because everybody else is stupid and they were jealous of their experience and they were threatened by how much money they were making, so they let them go.
Right.
Maybe once in a while that's true, but
I was in a training time I love this description of it. I don't know if you've ever heard, but they were describing the relationship of a narcissist, NPD, with people in their lives, and they were talking about it being like a food source, right?
Yeah.
And so feed off of whether it's the spouse, the
Yes.
children,
yes,
whatever
yes,
it be. And then the spouse many times will threaten separation, threaten divorce, and when they do, they are like on to the next.
correct. Or what they'll do, so once right,
present, right?
yes. So once they're supplied, so they kind of they need constant fuel to survive. It's like a car. It's like a gas tank. And they just constantly are driving around, pulling up to gas stations to refill their car. The problem is that the fuel tank isn't always the same person. It's kind of like once this spouse is empty, then they go to the kid. When the kid's empty, they go to a friend's, and they usually have multiple partners, multiple affairs simultaneously. And it's because when they get their needs met from this one, let's say it's sex, then they can go to this one for emotional, and then when they're done that, and so you're never kind of off their radar, and people misinterpret that as they still love me. No, it's just you serve a distinct purpose for them, and when they come back to you, it's not because they miss you. They come back to you because in that moment they happen to need the type of fuel that you give them, and when they're done with it, they put you back on the shelf until they come back to you again. The difference is that it's more than just using you. They will devalue you once they're done with you, meaning you went from great in a manipulative manner to horrible because you're no longer necessary to them. They don't need you anymore. When you're dealing with addiction that looks selfish, it doesn't look like that. Someone with addiction will still go to the same person because it's not about filling them up, it's about support. Someone with narcissism, it has nothing to do with support. It just has to do with that person's going to give them something they need. And if that person stops giving them what they need, that's when that love bombing comes into play. They will bend over backwards, buy you gifts, take you on vacations, tell you how much they love you, how sorry they are. And you think you're getting that person back that you had in the very beginning, but you're not, because it never existed. then you fall back into it. Yeah.
And I add too that, as you know, addiction, like any disease, is progressive, right? And so it's always get worse. And when it's progressing for a long period of time and for an extreme amount of time, they're going to be isolated, right? They're not going to have connection with people. They, you know, if you can imagine, you know, for an extreme example, we've seen all of the documentaries and all of the articles in the Philadelphia Inquirer about these mothers going down to Kensington with bags of food, bags of sandwiches, trying to find their children. Those children do not have narcissistic personality disorder.
Correct.
They
yes.
are alone. They are, you know, have cut off from the world.
Because they're ashamed and they're embarrassed and they've hurt. Right. That's an excellent point. Someone with narcissistic personality disorder, they're not cutting themselves off and isolating from anyone, because then they shrivel and they die. They need people around them to glorify them, right? To pump them full of fuel, essentially. Yeah, very excellent point. Yeah. So 2 quick things I want to summarize that Brynn said that I think is really important in the distinction between the selfishness and self-absorbed appearance of addiction versus that of narcissistic personality disorder. 2 main things. The one we just talked about, which is those with narcissistic personality disorder, they don't isolate from people. They need to be around people. Who just depends on what they need, but they don't exist unless other people are around them. In their kind of their sense of self doesn't exist unless other people are around them. Whereas somebody with addiction, who's in the throes of addiction or has, you know, engaged in a behavior that they have a lot of shame or guilt about, they're going to isolate, they're going to hide, they're going to associate only with people that they feel they can kind of bury that shame and that guilt with. They're going to isolate. So that's an important distinction. And the other one was what you had said in the very beginning, which was the shame, the guilt, the remorse, the empathy. Somebody with addiction is going to feel at their core really crappy when they mess up. Maybe not while they're using, maybe not while they're getting the drugs or getting the alcohol, but afterwards.
But even too, Jamie, when you talk to people in recovery about their experiences, when you know, a lot of times we're screening, have you ever had experiences with suicidal ideation or suicide attempts? And almost every time people will say to me, I've never actively tried to kill myself, but I have stuck a needle in my arm and prayed, dear God, please take me.
Take me. Yes, correct.
And I apologize if that's triggering to anybody, and there's a lot of connect out there. But I want to make that they, in those moments, you know, they may not tell anybody, but those deep, shameful feelings are so present.
Yes. This talk is, all my lives are saved on IGTV. So you can go to my page and click on my IGTV. I'm also going to save them to my YouTube channel. So all lives we do are always saved, and Brynn will have it on her page as well. And somebody with narcissistic personality disorder, they're not having those thoughts because they're great. Everything's great. And I think too, the really important thing is that, again, what you said in the beginning, somebody who has an addiction, let's say, their shame, their guilt, all this stuff would still have, and their empathy would still have been there prior to the addiction. Whereas someone with narcissistic personality disorder, even if they have an addiction, that lack of empathy, lack of remorse, lack of anything emotional was lacking before the addiction. So that's another really good way to kind of differentiate between the two. I think those are really key points.
The choice of substance is usually used to inflate the sense of self.
Yes. Whereas with depression, anxiety, it's usually to avoid it, suppress it in some way, not enhance it. Excellent. No, I think that is so unbelievably helpful. I learned a ton, so I imagine everybody really learned a lot from this, especially the nuances of the difference between the two. We can talk about the similarities, but I think it's the differences that are really important to know.
Helpful, definitely.
So Brynn, can you tell people where they can find you and kind of your information?
Yeah, absolutely. So the website for the practice is bcatherapy.com. You can find me, it's Brynn Brynn Cicippio, Cicippio. You can find me on Instagram. You can find me on Facebook. There's, I think, maybe 6, 9 videos on a YouTube channel that we did in the spring related to managing coronavirus. You can find me right here on Instagram as well. And just the website. Yeah, Google me. Psychology Today. I'm kind of all over.
Awesome. All right. Thank you. Thank you so much for doing this. This was
right now, so
yeah, this was excellent. So thank you. I know everyone's very appreciative of this. And like I said, this will be saved on IGTV, and you can access it on YouTube as well. So thank you everyone for joining, and we will talk to you later.
Great.
Bye-bye.
Thanks.
Thank you.